Greetings, my name is Ahoua Kone, and I work at the Interfaith Health Program based at Emory University in Atlanta, US. I'll be highlighting key findings and recommendations from Session 4 entitled Using Data to Document the Impact of Faith Models from posters presented at AIDS 2020 from the virtual HIV Interfaith Conference facilitated by Dr. Susan Hillis. Dr. Hillis is a Senior Advisor for the United States Global AIDS Coordinator and Senior Advisor in the US Center for Disease Control and Prevention. At the beginning of the session, Dr. Hillis grounded the session in the theme of the conference by providing an overview of evidence-based approaches to resilience and highlighting the factors that are particularly evident in interfaith communities. We then proceeded to have our first presentation, which featured Circle of Hope Zambia. In 2017, Circle of Hope embarked on a journey to see how they could increase case identification, linkage, and retention in Lusaka. At the time, 78% of adults and 79% of children were accessing ART treatment. The hope was to get the country closer to 90-90-90 goal. They identified 5 barriers that inhibited men and other sections of society from accessing HIV treatment: stigma, time spent at public and private health facilities to access treatment, cost of traveling to facilities, isolated health workers or institutions, and healthcare workers who were not knowledgeable about care. To address these barriers, Circle of Health developed various approaches, including but not limited to decentralizing service delivery and engaging community health workers. These efforts led to over a 12,000% increase in case identification across the board and 700% uptake of medical services by men and 670% increase by children. Approaching clients with empathy and in close collaboration with religious leaders contributed to these noticeable increases. The Circle of Hope's presentation was followed by Care for AIDS, which operates centers in 68 communities throughout Kenya, Tanzania, and Uganda. Each center partners with a local organization that offers their building and their office space free of charge. It's a cost-effective model and discreet approach for clients dealing with stigma and reluctant to visit health clinics. In order to decrease viral suppression of clients and achieve the fourth 95 goal, the center social workers conduct weekly one-on-one counseling sessions, physical health practices, emotional health well-being, bi-monthly group therapy, monthly home visits, bi-monthly economic empowerment seminars. For Kenyan clients that graduated from the program in 2018 and 2019, Care for AIDS noticed approximately 20% increase in self-disclosure rates for clients. The next presentation we had was by the Lu Commission. The Lu Commission is an FBO in Eswatini that provides free comprehensive medical service to the community. In early 2019, they noticed that while PrEP was widely available, there was not much in the way of client education about the population that may benefit from it or how to become initiated on it. So they designed an uptake plan that integrated PrEP into the comprehensive health services offered. First, they synthesized the HTS counselors regarding the availability of PrEP for at-risk clients and integrated PrEP screening questions into a comprehensive patient assessment tool as part of the electronic. 1,862 clients were initiated on PrEP between March and November 2019. Integration into the comprehensive medical services was found to be a key to the success and the growth of initiation. Training was also important at the beginning, and refresher trainings to healthcare workers provided throughout the initiative, as well as a quality assurance checks to ensure that healthcare workers were presenting PrEP in a way that was helpful for clients. The final presentation was by Eastern Deanery AIDS Relief Program in Nairobi, who currently has 28,000 adults and children on treatment serving all members of the community. To increase HIV case finding and linkage into care for persons living with HIV, particularly men, faith-based engaged faith leaders and both, let me start that over. The final presentation was by Eastern Deanery AIDS Relief Program in Nairobi, who currently has 28,000 adults and children on treatment, serving all members of the community. To increase their HIV case finding and linkage to care for people living with HIV, particularly men, they engage with faith-based leaders in both community and clinical settings to introduce self-testing in Nairobi. They trained all staff members and community health workers who are also faith leaders in their local faith communities. The key part of this intervention was a referral card used to track all self-tests And some of the overall lessons learned from these presentations included establishing trusting relationships with religious leaders and community members, as well as training clinical staffs to make sure that they treat all members of the community with both compassion, empathy, and remember that these are individuals with dignity and not just statistics to be referred to later on. These presentations demonstrated the real-life impact faith-based health organizations, religious and community leaders can have when they build trusted relationships and leverage their influence to improve the health of the community.